I want to begin by saying that I think it's extraordinary that we're having this conversation in a hospital. And where I would like to spend a little bit of time is talking about why I, as a family doctor and as a proud administrator in this hospital, I get to work with so many of the extraordinary women in this room, why I care about equity, and why I think it is that an organization, a healthcare organization like ours, cares about equity. So in order to understand why we should care about equity as a healthcare organization, you need to ask the very simple question, what makes us sick? What is it that makes people sick? Is it viruses? Is it bacteria? Is it your genetic predisposition? Is it, bad luck? Is it exposure to trauma? And the answer is yes, it is all of those things. But actually, nothing makes us sick more than inequity does. And there's a parable that illustrates this quite nicely. If you imagine that you're standing on the edge of a river and looking at the beautiful scenery, and you look out into the water and you suddenly see a baby floating by, drowning in the river. And so, of course, you do what we would all do. You jump in and you fish that baby out of the water and rescue it. And just as you're bringing that baby to shore, you turn around and there's another baby floating by in the river, and you think, oh, this is completely bizarre, but you jump in, of course, and then you turn around and you see that actually the river is littered with drowning children. And all around you, people are jumping into the water to try to rescue those babies. And at some point, some intelligent person is going to ask, who keeps chucking these babies in the river? And you're going to head upstream to find out. And so this parable is intended, as frequently used, to illustrate the critical importance of upstream factors that affect health, what we call the social determinants of health. And in fact, I would venture to say all of the areas in which we are all engaged in fighting for equity in our communities are precisely those upstream factors. They are the absence of the fence around the cliff at the top of the river. Issues such as income, which is actually the primary determinant of health, employment, race, indigenous status, social inclusion, and of course, gender. So if we care about health, we cannot ignore those upstream factors, those social determinants that actually determine, in fact, much more of the health of a population than access to healthcare services. And I feel I'm sort of preaching to the choir here because I suspect that most of you are here because you feel as passionately as I do about the need to address those upstream factors that influence the health of Canadians and of global communities as well. So much so perhaps that you might have asked yourselves the question that I have more than once asked myself, which is, given the critical importance of the social determinants of health, why should we really be spending any time on health care at all? I mean, if really what we care about is improving the health of Canadians, shouldn't we all be in the education field? Shouldn't we all be in anti-poverty work? Shouldn't we all be trying to address those upstream factors? And the answer is, of course, we don't have to choose. We can do both. And that is what I think Women's College Hospital is, in fact, trying to do. The reality, though, is that we do live in an imperfect world. We do live in a world in which our communities do not have equitable access to those social determinants of health. And in that imperfect world, one of the biggest equalizers, or equalizers, if I can invent a word, is the existence of a strong, universal, publicly funded healthcare system. So, if we care about health, we need to address those upstream social determinants, but we equally need to fight to ensure the delivery of high-quality, truly accessible, publicly funded healthcare to each and every citizen in our country, because the reality is that actually, although people don't use this word very often, perhaps not often enough in our community, a publicly funded healthcare system really is a tool of redistribution. It is a tool to redistribute from the healthy and the wealthy to the unhealthy and the unwealthy. And it is one of the few tools available to us in our Canadian society to try to right some of that imbalance that we see in the social determinants of health, so that at the very least, when a person who's experienced marginalization of all kinds shows up at the hospital door, we're not on top of that asking them for their credit card. We're not on top of that putting additional barriers in place in order that they be able to access those downstream determinants of healthcare services. Well, so that's what's driven pretty much all of my career so far, is beginning from a passion for equity and social justice. It's brought me to the point of understanding that as a healthcare provider, although a healthcare system may not be the primary determinant of what makes my community healthy, it is one of the tools that we can use to cushion people from the inequities that they experience around the social determinants of health. And unless we think we're done in that domain, I want to point out that in this organization, which is entirely an outpatient organization, the hospital to keep people out of hospital, the hospital without beds, the hospital without the hotel, the hospital without the emergency department, my ability to offer that equitable access to healthcare services in my own work every day ends at the moment that I hand my patient a prescription for the medicine that they need to cure their illness. So unless you think we're done with a 50% female cabinet, I would submit that we are not done until that cabinet has passed a policy of universal pharmacare across the country. Because in fact, I think what we're going to see increasingly as the millennials come into the workforce and as we see the rise of precarious work across our communities, more and more people, and in fact, if you look at the statistics on this, more and more women and young women working multiple jobs, working part-time jobs, working on contract, working in environments where they don't have access to what we would think of as traditional benefits, we are going to increasingly see that the problem of inequitable access to prescription medications is going to become a gendered problem. And so I actually believe that this is one of the many reasons why we need to be agitating hard as a community for the inclusion of medically necessary prescription medicines within Medicare. So I'm going to end by saying that I don't think that there's any other hospital in the healthcare system in this country that both recognizes the need to be having a conversation about equity and the social determinants, including around gender, and that commits and recommits every day to doing better in the provision of equitable access to healthcare services. But it makes me incredibly proud to be able to participate in an organization like this and to be able to sit on a panel of extraordinary women like this one. So thank you all for coming. I think it's clear from the conversation today that our work is not done, but I also think that it's important that we remember that this entire conversation, although it perhaps hasn't been labeled that way in every single one of these presentations, is a health conversation, and we need to think about it explicitly as a conversation about health. Thank you.